Hello, massage friends. It's Stephanie, the Executive Director of USOLMT. And I wanted to talk to you today about some of the differences that we found in the AMTA Profession report from 2021 to 2022. So if you have not read this report or you are not a member of AMTA, every year they do a profession report that's aimed towards massage schools. And so they do surveys and provide statistics for school owners about what's going on in the world of massage therapy. And the last few years that I've been working on USOLMT, I have taken these reports every year and identified what the differences are from year to year as to what's going on in massage. So that's what I want to talk about today. What areas are we growing in? What areas are we decreasing in? Just to give you that information, I think some of this stuff might be helpful to you as a practitioner or as a business owner. So I'm going to go ahead and get started. So it looks like the number of Americans that are receiving massage between 2020 and 2021. So all of this is just in the years between 2020 and 2021. Okay. The number of Americans receiving massage increased by 2%. And the number of massages received by those Americans decreased by 0.2%. A little bit more people were getting massages, but they were getting a little bit less massages than they were before, prior to 2020. The number of appointments that consumers had to cancel during COVID-19 from 2020 to 2021 increased by 6%. So quite a bit more appointments were impacted by the COVID pandemic in 2021. Now, the same 92% of consumers expect to get another massage within a year. That number has not changed. And the same 92% of consumers believe in the efficacy of massage, and that number has also not changed. Consumers who believe that massage can be beneficial to health and wellness, that number was a little bit surprising to me. That number has dropped by 2%. And then there's a percentage of consumers who had massage for health and wellness reasons. That number increased by 10%. So when they're looking at health and wellness reasons, it looks like they're looking at pain management, injury treatment, stuff like that. Not so much relaxation and stress reduction. So 15% increase in therapists who have returned to work. So between 2020 and 2021, 15% more therapists went back to work. And it looks like we've had an overall loss of 6% of massage therapists who are not practicing at all. 14% of therapists continued to practice, it looks like, even through lockdowns when we were maybe not supposed to be working. And that's not a big number, but 14% is kind of a lot when it comes to skirting guidelines, I guess I would say. And who knows why that was? Maybe it was out of necessity that they had to work to keep paying their bills. So we don't really know. There has been a 22% increase in the number of clients seen between 2020 and 21, but the overall number of clients that massage therapists are seeing is still down 13% from pre-COVID numbers. So while we're seeing more clients, we still have less clients, which is a little bit hard to understand, I guess, but the overall client numbers are still down from what they were pre-pandemic, but in the last year, between 2020 and 2021, more clients have been coming in. So, and it's a lot more. It's a 22% increase, so that is quite a bit. There is a 3% drop in the number of massage therapists. So in 2021, AMTA notes that there are 351,588 total massage therapists in practice. I've been saying all along, we've seen an increase in the number of solo practitioners. AMTA reports that there is a 5% increase in solo practitioners There is a 2% decrease in the number of female practitioners who are practicing. There has been a 1% drop in those who had a different career prior to becoming a massage therapist, a 1% drop in therapists who support massage being integrated into healthcare. So I find that interesting. A 1% drop is quite a bit, actually. A 2% drop in the number of massage therapists who were reimbursed by healthcare insurance. So that number is also going down. A 6% increase in the number of massage schools who have reopened in 2021. And there have been 15% of schools that have dropped online learning from 2020. So a lot of schools increased their online learning options, but then 15% of those schools dropped those options in 2021 and went back to traditional teaching models. There has been a 45% of schools who are reporting a decline in enrollment due to COVID-19 throughout 2021. And the number of average education hours dropped. It was 677 in 2020, and it has dropped down to 673 hours on average in 2021. So it's not a big difference, but the number of educational hours does seem to be going down. There has been a 5% drop in the number of schools offering CE in addition to massage therapy certification. So it looks like some schools may have closed up their CE programs and they are no longer offering those. And then across all schools, the average number of graduates is down by 2 graduates per year. And each school looks like they're graduating an average of 31 students per year. So massage classes are still really small, and they are not turning out a ton of people every year. Both years, the top school challenges have been COVID issues and difficulty in attracting new students. And the number of consumers who, okay, then there's a bunch of consumer statistics. So I want to talk about the COVID issues and the difficulty in attracting new students. We'll talk about that more a little bit later. But trying to find ways to get people into our profession is obviously really important. And I think that that starts with schools. And this is a disturbing number that so many of them have been reporting that they've been having such difficulty attracting students into the profession. So I really think that we need to consider what we can do differently to attract more people into the profession and how we can make that happen. To me, it starts with educating the public, right? Because as the public knows more about massage therapy and what it's all about, then maybe we wouldn't have the problem of only 23% of all Americans getting massages. That's not very many in the overall scope of things. So a big public education project, I know it would be kind of a monumental task, but I believe that that would be hugely beneficial to the industry. Now, there's a bunch of statistics about the consumers. So the number of consumers who said they would look into massage in 2020 once their state or city restrictions were lifted has dropped to 5%. In 2020, 55% of consumers said that they would look into massage maybe once testing was available or once vaccines were widely available. But in 2022, 56% of consumers, and I'm guessing it's kind of the same consumers, they base looking into massage based on the vaccination status of them, their vaccination status, the vaccination status of their therapist, and whether there was wide vaccination in their local areas. So vaccination is a big deal to consumers. 56% of them want to know, and they want that safety. There has been a 27% drop in consumers who said that they would get a massage based on the status of the COVID crisis. And that makes sense. I mean, everybody seems to be kind of over it, right? So it's not as low, actually, as I thought it would be. I believe if they survey that number for 2022, that's going to be a lot higher. 40% of people said that they're comfortable 40% of people said that they would get a massage when they were comfortable with the safety measures that their massage therapist uses in 2022, and that was the #1 concern of the public. Now, the safety measures that are being used are most often, sanitizing and stuff like that. Air filters was one that was not quite as high. I think it was only in the 40%, but that is actually the #1 thing that massage therapists should be doing in order to make their practice safer, especially with any kind of airborne or respiratory disease. And it's not just COVID-19. It could be colds, it could be influenza, it could be RSV, it could be anything. Air filtration is the #1 thing that you can do. And if you have not done it yet, I would increase the air filtration or get a purifier. Look for M13 HEPA filters in your HVAC system and just get that done. Obviously you do want to keep your cleaning and your sanitizing up, but that's not the main way that most respiratory or communicable diseases are transmitted. They are airborne. So I would suggest that you look into that. Also, as far as what consumers cared about, so there's been a 12% drop in consumers asking about sanitation standards. And I assume that that number will also continue to go down over the next year. There has been no change about the number of clients who really care about wearing a mask during a session. It's still about 44%. And then 41% want to know if their therapist has been vaccinated. And that is quite a bit of people. Another statistic that is not really surprising is that males are getting more massages than females. And that has been going on for the last 2 years. I don't know if there is a correlation in the amount of sexual harassment that therapists have been suggested or subjected to over the last couple of years based on more males getting massages, but it does kind of make me think. It makes me think. I know that, men are getting more used to taking care of their hygiene, taking care of their health. They're getting pedicures. They're doing stuff that is great and wonderful. And I love that more men are getting into self-care, and massage is a huge aspect of that. So anyway, the number of males getting massages is going up. More men are getting massages than females now. There is the higher income consumers are getting more massages. Obviously, it's a more affordable service for them to be able to receive. And one thing that I mentioned on one of my previous videos that I really want you to take note of is the number of Americans between the ages of 18 to 34 getting massage has increased by 10%. And I said in one of my previous videos that marketing to Gen Z and marketing to the millennial audience is going to be very important moving forward, and that over the next couple of years, you may see a trend where this is the main age bracket that is receiving massages. And I still believe that's going to be true, especially based on what I see with these numbers. The number of Americans aged 35 to 44 dropped by 1%. So they're getting little less massage. There was a 7% drop in the number of those people who are 45 to 63 receiving massage. So that's a pretty significant drop. And then there's been an increase in the consumers that are receiving massage for health and wellness, like pregnancy, injury treatment, pain relief. And then there's also been an increase in consumers receiving massage for relaxation and stress reduction, but not as much as those seeking massage for pain relief. The number of consumers receiving massage at a massage therapist's office has increased by 17%, and that is double what it was in 2020. 34% received at a spa, 34% at a massage therapist's office, followed by franchises and chains, and then beauty salons. So I think that that really speaks to the number of new practitioners who have gone into solo practice and are no longer in employment situations. And the fact that that number has doubled, that means that a lot more people are seeing independent practitioners now than they were before. Now, the number of new grads entering the profession in 2021 was below the number of people leaving the profession. So the average number of people in our profession has gone down by 3%. We are not getting new people. The pay has increased $3.41 in the franchise environment, but the tips have decreased by 13 cents, which may not seem like a lot, but over the course of a year, that is a lot. The pay decreased. Now, I find this one interesting. So the pay decreased in the hospital or medical environment by $1.75 per hour, but the tips in those environments has gone up by almost, well, $9.61. There has also been a pay increase, $1.70 an hour in chiropractic offices and $1.29 in spa and salons. Now, therapists are making a lot more money when they work in their home and their own offices. It looks like they're making around $10 per hour more than other different types of settings. At a hotel or resort, cruise ship is also included in this, but I suspect that number is quite low. How many massage therapists are working on cruise ships right now? But they're getting around $11 more. So the hotels and resorts are paying quite a bit more and have increased their pay quite a bit more for therapists over the last year. And then around $6 more, therapists are making around $6 more working at their clients' homes. So mobile massage therapists are making a little bit more money. And the gross annual income. Now, between 2019 and 2020, there's no 2021 statistic in this report. So it's that the gross annual income dropped by $1,040 for massage therapists, which is more than 20% of their income. I do not know where the 2021 statistics are. Full-time employees were earning more than solo practitioners, a little bit more, not a lot, but full-time employees were earning a little more. Therapists look like they're keeping 3% less of their fees when they go to their clients' homes. Therapists are keeping about 1% more of their fees. When they go to their clients' homes, they're keeping 1% more of their fees, but they're keeping 3% less of their fees when they work out of their own homes. So maybe that's as far as expenses and things like that they need to buy. Therapists are keeping 1% less at clients' workplaces, but they're keeping 1% more at their offices. And at the hospital or the medical clinic, they're keeping 24% less. So that's quite a bit. That's a big number of how much less of the price of the service the massage therapist is getting paid in the hospital or the clinical setting environment. And it looks like at the hotel or resort environment, therapists are keeping 7% more of the price of the service. For spa and salon and franchise, those numbers have not changed. It's still about 50% at a spa or salon, and it's about 32% at a franchise. And that is the percent of the service that the therapist would get paid. And then benefits. So benefits have changed quite a bit too over the last year. There are more employers that are offering free or discounted massage as a benefit to massage therapists. There has been about a 4% rise in that number. PTO is an interesting one. PTO was the least offered benefit in 2020. Today, well, with this report in 2021, it was the number 2 benefit offered. PTO went from 38% in 2020 up to 55% in 2021. So PTO has kind of moved from that bottom tier to the second highest benefit offered to massage therapists. I also found it interesting that health insurance, the number of employers offering health insurance has dropped roughly 8% between 2020 and 2021. The number of massage employers offering dental insurance has gone down about 10%. Free and discounted continuing education has gone down about 10%. Life insurance options have gone down about 7%, and retirement plans have gone up about 8%. So I find that interesting. Now, as far as the type of practitioner in the market, there has been about a 5% growth in solo practitioners. There are about 2% less full-time employees, 1% less part-time employees, and therapists are working about 4.6 hours less per week than they were prior to 2020. It looks like they're spending about 2% less time cleaning and sanitizing than they were in 2020 as compared to 2021. And only 1% are working on insurance reimbursements. So it's like a really teeny tiny number of therapists that are getting reimbursed by insurance. As far as marketing goes, I thought it was interesting that only about 61% of massage therapists have websites. That is actually 2% down on the number of therapists who have websites between 2020 and 2021. Most therapists are doing their marketing through their website, Facebook, Google Maps, or Google My Business. More massage employers are using more paid social media and advertising on more deal sites than independents. And it looks like therapists are using practice management software a little bit less, actually, and it has increased slightly for employers. The use of accounting tools like QuickBooks has increased. SOAP note charting software has actually decreased. And the insurance billing software has decreased, especially among employers. It looks like there are a lot less employers that are doing insurance billing in the last year. And online payments has increased quite a bit, especially among independent massage therapists. And the other thing that's interesting as far as marketing goes is that email and newsletter services, that use has decreased by about half among both groups. So Facebook use has dropped about 4% for professional use, but it has increased for personal use. It looks like about 6% of massage therapists are using LinkedIn, a little bit more for personal use. Instagram use is about the same. YouTube usage has grown a little bit for personal use. But still, when we look at it, Facebook is still the most used social platform for massage therapists. Twitter, Snapchat, and TikTok are still the least used. Now, between 2019 and 2020, about 870 spas closed, and that statistic was according to iSpa and their yearly report on the spa industry. So that's quite a bit of spas. Employment in spas has actually increased slightly, even though so many closed down. 6% of massage therapists work at national franchises or chains. 61% of therapists believe that the healthcare profession respects massage therapists, while 23% do not feel that massage is respected. So most of the massage profession believes that they are a respected part of healthcare, and they see that we can easily work alongside healthcare providers and things like that. But there's still like a little over 20% who don't think that they're respected at all. So I think if some of that is just kind of like changing perception and showing massage therapists statistically like what kind of environments they can work in and what that looks like. And maybe a lot of them just don't know. There's some reduction in all of the medical reasons why a person would seek out massage therapy. That includes pain relief, headache, migraines, all of that stuff. But preventing and improving their quality of life and relaxation and stress reduction, those numbers stayed the same. So there's not more and there's not less as far as people who just want like massage for prevention and things like that. But I found it interesting that there's been a reduction in the reasons why a person would seek out massage for pain relief or something like that for a more medical or clinical type reason. The number of healthcare providers that are recommending people to get a massage is actually down from 2020. In 2021, the number of physicians that were referring massage therapists went from 50% in 2020 to only 36% in 2021. And then as far as schools go, the number of school applicants admitted into massage school has grown by 4%. I don't know if that is created by a lack in the standards to get into massage school, but it could be. And the number of school applicants that have, the number of students has gone down. With COVID-19, they say that schools are having a lot of difficulty attracting students, and helping students prepare for the influx has become a much bigger concern. They have difficulty finding qualified instructors, and the number of schools accredited by major agencies has gone down about 10%. 42% of schools are reporting having hiring challenges. There are big increases in instructor candidates lacking classroom management skills and teaching experience, about 20% or more. And 93% of the programs require high school's diplomas, but 7% don't. And 61% of schools have a job bank, 26% offer formal placement programs, and 73% have a placement rate over 80%. So I feel like another thing that might be good is to offer more formal placement programs to students. So maybe that's another thing that we can talk about in the future. So that's it. Those are all the differences. I am glad to have provided you this information today, and I will talk to you again soon.